Good afternoon, everyone. Thank you so much for joining. We will begin the webinar in about 2 minutes. Hello to those attendees who just joined. As I mentioned earlier, I want to give folks maybe 30 seconds more because I do see some folks trickling in. So let's begin at 2:02 p.m. Eastern. Thank you so much. All right, let's go ahead and begin. Good afternoon or morning to everyone. Thank you so much for joining us today for our webinar. I am happy to welcome you to the 4th installment of the webinar series, which is titled Environmental Health Data Webinar Series. My name is Reem Tariq. I'm a Senior Project Coordinator at the National Environmental Health Association. At NEHA, I manage projects that focus on federally unregulated drinking water, climate and health, as well as some emergency preparedness projects. As part of this webinar series, I just want to let you know that NEHA has been working in partnership with the Virginia Department of Health on how to use environmental health data to make data-driven decisions. Our webinar today is titled How Washington State Department of Health's Tracking Program Uses EH Data to Promote Data-Driven Decision-Making for Climate and Health. This presentation will provide an overview of Washington Tracking Network and how they used environmental, climate, population, and health data to improve public health. Our speaker for today is Jennifer Sabel. Jennifer is the Senior Epidemiologist and the Section Manager of Environmental Health Epidemiology and Toxicology Section at Washington State Department of Health. She serves as the Principal Investigator for several federal grants, including the Washington State Tracking Network, a program focused on providing health and environmental data and tools to inform data-driven policy and programmatic decisions. She has been the epidemiologist at Washington State Department of Health for 20 years. And before I turn it over to Jennifer, there are a few housekeeping items that I do want to cover. First off, this webinar is being recorded. The recording to this webinar will be placed on the NEHA website 2 weeks after its completion. If you do need the recording sooner than that, perhaps to share with your colleagues or anything along those lines, feel free to email me. I will be sharing my contact information towards the end of the presentation, and I can provide you with a link to the recording. As far as questions, we will be holding all questions until the end of the webinar after the presentation. But if you do have any questions, feel free to insert them in the Q&A box at any point, and we will take questions towards the end. Last but not least, please take the survey that is going to pop up as soon as you exit out this webinar, because it does help us in planning for future webinars. And with that, Jennifer, I'm going to stop sharing my screen and turn it over to you.
Okay, great. Give me just a minute. Share my screen. Let's see my desktop first. Oh, there we go. Okay, great. Well, good afternoon or morning, depending on where you are. My name is Jennifer Sabel, and I am going to be sharing, mostly focusing on our environmental health disparities map and how we are using that to promote data-driven decision-making for climate and health, and also environmental justice issues. This is the outline of my presentation. So I'm going to share a little bit about the history of the environmental health disparities map. I'll talk about the methodology and the cumulative impact model that we use. And then I'll talk about some of the policy and programmatic uses of the map. There are three major pieces of legislation that have passed since we created the map, and then I'll talk a little bit about the next steps and where we are with the map. So just wanted to start with some background. At the Department of Health, we have a strong focus on achieving health equity, and health equity, as you may be aware, exists when all people have the opportunity to achieve their full health potential, regardless of race, culture, identity, or the neighborhood that they live in. And we acknowledge that everyone in Washington state may not have this opportunity. The health inequities exist when there are differences in health outcomes across different groups of people, and the root causes of those differences are systemic, avoidable, unfair, and unjust. On the Washington Tracking Network, we leverage the power of GIS to understand health equity in our communities and provide insight into the patterns of inequity and to inform more equitable decision making. Okay, slide. And then just a little bit about the connection to the environmental health disparities and health and climate. So we know that while the risks from climate change will increase for everyone, climate hazards threaten some populations more than others, such as people with lower income, the elderly, socially isolated, communities of color, and workers that are primarily working out of doors, like farm workers. These populations have less resilience because of the vulnerabilities. And these are the populations that, therefore, we need to focus on when we're planning for climate resilient and healthy communities. These are the groups we need to engage so that no one is left behind as we transform our communities to face a climate impacted future. And as we all know, the climate change threatens the health of our communities. As climate change increases, the frequency and intensity of weather-sensitive hazards are a chance of exposure to health risks like extreme heat, wildfire smoke, water and foodborne pathogens, or just displacement and disruption to critical health services increases. Oops. So the work to create the vision for the environmental health disparities map was really driven by the communities that are on the front lines of climate and environmental change. These are the communities that have historically been more impacted by environmental hazards and population vulnerabilities, and are the same communities that will feel the greatest impacts from climate change unless we give them the tools to adapt. These communities worked through a non-governmental organization here in Washington called Front and Centered to advocate on their behalf for us to create a tool in partnership like the Environmental Health Disparities Map that they could use to support their need for environmental justice. So I just want to acknowledge that the creation of the map was definitely a partnership. Front and Centered, which I mentioned, is a statewide coalition of over 60 organizations and groups here in Washington that represent communities of color, migrant workers, and other groups throughout Washington. They were the initial organizing force for the development of the Environmental Health Disparities Map, really being called to action by the communities that they represent. And they organized the partners whom you see on this slide, and we all worked together over a 2-year period to create the Environmental Health Disparities Map. This slide just shows some of the key pieces of the development timeline. The work group started back in 2017. One of the key pieces in the beginning were some community listening sessions, and I'll talk a little bit more about those in a minute. We reviewed existing methods and tools, held a couple of, and sharing what we had learned back with the community through a symposium in 2017, and then a community webinar closer to when we were releasing the final version of the first tool, which was released in January of 2019. So the listening sessions, these played a huge role in the development of the Environmental Health Disparities Map. Front and Centered staff led these conversations, and there were 11 sessions that happened in 2017, a few additional conversations that continued into 2020, but represented by the blue stars on the map were the 2017 set. These were 2-hour listening sessions that let community members speak for themselves on the pressing issues and helped us better understand what those concerns were. And they were really driven by these 2 open-ended questions that you see on the slide. So the Washington Trucking Network was asked to be a partner in this collaboration because of our prior work with creating a diesel pollution and disproportionate impact map on which exists on our information by location tool, which is one of the tools we have on the Washington Trucking Network. And this particular map uses data to highlight health and environmental inequities. And our partners used this to identify communities that they could target resources towards that were in the greatest need. This map and our Environmental Health Disparities Map, as I mentioned, are on our information by location tool, which is becoming one of the most important tools that we use here in Washington state government to identify where inequities exist and to inform which communities we need to be engaging and where to direct resources to address both environmental and climate justice issues. So I'm going to shift gears a little bit and talk about the methodology and the cumulative impact model that form the map. So one of the other key pieces that we did, in addition to the listening sessions, was to review other existing methods and data. There were 2 key existing resources that we looked at. The first is California's EnviroScreen, and the second was EPA's EJ-Screen tool. Our group favored the California model and used its conceptual formula there at the bottom, where the risk is a combination of the threat, environmental threats, and the population vulnerability. It estimates a cumulative environmental health impact score for each census tract in California and reflects the pollutant exposures and the factors that affect people's vulnerability to environmental pollution. So the feedback from the listening sessions and the literature review and the tools helped identify these 19 indicators that are currently on our tool. We also had to rely on data that was available for Washington State at the census tract level to include in the environmental health disparities map. The team conducted a principal component analysis or a sensitivity analysis to explore the relationship between the indicators to ensure that each indicator was adding a unique value to the overall map. And these 19 indicators fit into 4 different themes listed there on the top: environmental exposures, environmental effects, sensitive populations, and socioeconomic factors. And so then this is our model. Like the California model, we use the same conceptual model where the risk is a combination of the threat and the vulnerability. The threat is a combination of those environmental exposures and effects. Environmental effects are indicators that have a more indirect impact, so they're weighted at half of the value as the other indicators. The vulnerability is made up of population characteristics that affect people's susceptibility to environmental pollution, including economic factors and sensitive health conditions. And the overall model then calculates a final cumulative environmental health impact score for each census tract, which is the overall risk. I just wanted to talk a little bit more about this cumulative impact model because I think it's really important. I think the model recognizes that all of the things in our lives are really interconnected and have an impact. So health disparities are linked to both social and environmental factors, and people's biologic susceptibility and the impact of those environmental factors. And then the social vulnerabilities then amplify any of those effects to environmental hazards. And it's been shown that when these models are used, there is a greater likelihood that overburdened communities will receive the needed attention that they deserve. So this is just an overall snapshot of what the overall environmental health map looks like. The map uses a relative ranking system in order to compare all the communities in Washington State as defined by census tracts to each other. The map ranks census tracts across the state using the 19 measures. It also ranks the 4 different themes and then creates an overall rank. And the census tracts are approximately equally distributed across the 10 different ranks. So people that live in census tracts with a 1 experience the least environmental health disparities risk, and census tracts that are ranked a 10 experience the most risk. A census tract with a relative rank of 8 means that 10% of the communities have a similar impact, also have an 8. 70% have, in the 1 through 7, have less impact, and then 20% of the communities have a higher impact. A couple things to note about this map, that although this is a really helpful map to identify communities who are overburdened and highly impacted by environmental hazards, the map is not comprehensive. There are environmental threats and vulnerabilities that are not included in the model. And therefore, we try to communicate to the users that the map really should be used as a starting place to identify communities at risk, and that they should look at other locally available information about those communities. Also, the rankings are really relative rankings that show the relationship of one census tract to all the other census tracts in Washington. They're not absolute rankings. So a 10 doesn't necessarily mean that a standard or a benchmark has been exceeded. To determine this, you would need to look at the data that is underlying those rankings, and all of that is available through the tool. So just have a couple slides to show you that there are some real health differences across these ranks. This one shows the difference in life expectancy across the ranks. The average is the red line, which is 80.5 years of life expectancy in Washington state. And the data show a linear association between the census tract EHD ranks and life expectancy. The data indicate a 5.7 year difference between the edges of the ranks. So in other words, the population in the census tracts with the lowest environmental health disparities rank, or rank 1, on average lived 5.7 years longer than those in the highest rank, or rank 10. And these data help illuminate what we already know. Living in areas with more environmental hazards and population vulnerabilities is associated with a shorter lifespan. And then this one is just shows you that linear relationship between the ranks and poverty. This figure shows that the poverty rate in the highest rank, rank 10, is more than double that of the lowest rank. And then we also look at race and ethnicity by the environmental health disparities ranks. In the lowest, or rank 1, it's 83, comprised of 83% of the population is white, 1% is Black, and 6% Hispanic or Latino, while the census tracts that have the highest rank of 10 are 46% white, 11% Black, and 23% Hispanic or Latino. So Black Washingtonians are 10 times more likely to live in the highest ranked census tract than the lowest ranked census tract. And if race was not associated with the environmental health disparities ranks, you would expect the census tract to have similar racial proportions. So before moving on, I just want to acknowledge that another limitation of the map is that it doesn't track assets necessarily, like community resilience, community cohesion, and other community assets. The map can be used to identify the most impacted communities, but communities are really bigger than their problems, and it's important to use an asset-based approach when thinking about this and to be conscious of the narrative that you're telling. So next I want to turn to share with you a couple pieces of legislation that have passed in Washington that reference the environmental health disparities map, and we've used it already to target programmatic efforts. And then lastly, I'm going to share with you a couple of program uses by one of our state agencies that is particularly climate focused. So the first piece of legislation that passed was the Clean Energy Transformation Act. And this passed just after we created the first version of the map in the 2019 legislative session. The Clean Energy Transformation Act, we also refer to it as CETA, commits Washington State to an electricity supply free of greenhouse gas emissions by 2045. And under this legislation, the Department of Health was tasked with developing a cumulative impact analysis to designate the communities highly impacted by both fossil fuel pollution and climate change in Washington. And then the goal of doing that designation was to highlight communities that are experiencing a disproportionate share of environmental risk factors, and that these risk factors, these communities then must benefit equitably in the transition to a clean energy economy. Okay. So we didn't have to use the environmental health disparities map for this cumulative impact analysis, but we decided to, and there are several reasons for that. One, we didn't have a ton of time to do this work, and then COVID also happened. But besides that, the environmental health disparities map represented a valid assessment of communities that are already currently impacted by fossil fuel pollution and are highly vulnerable to present and future climate change impacts. And we know that because that a lot of the vulnerabilities that exist in our highly impacted communities on the EHD map are also will experience those vulnerabilities to climate change. We know that some of these vulnerabilities will depending on the specific climate hazard, but there's a lot of overlap among the factors, and the vulnerability factors in the map highlights the communities that will be and already are highly impacted by climate change. And then the other reason is that the environmental health disparities map had already become a well-known tool for looking at vulnerability to environmental hazards and was used by several state agencies at that time to make funding decisions. And then lastly, just the strength of the cumulative health impact model that we use in the map. So the definition of a highly impacted community that we came up with first of all, CETA had already defined that any census tract with tribal lands was by default a highly impacted community. So we incorporated that, but that was not already decided for us. What we did add was any census tracts that had a 9 or 10 overall rank on the environmental health disparities map. And then this just is a little snapshot that shows you how we use the map overlays to show the tribal land boundaries on top of the map. One of the other things we did with this task that we were assigned was to add 4 measures of climate projections as an overlay on the map. And then they were also added to one of our other tools, which is called the data portal. So where people could find more information about each of these measures. We did this because we know that that we need to understand how the climate will change in Washington and what the impacts will be. The climate change projections provide this information through mathematical modeling of the anticipated changes. The measures that we added focused on temperature and precipitation. They were selected because they are particularly relevant to public health. They can be displayed at the census tract level, and they have impacts across the state. So due to some limited data availability, we're not able to add all potential climate risks at that time. For example, sea level rise, inland flooding, and wildfire risk were not included, although we are starting to work on some of those right now. Okay, so the next piece of legislation that I'm going to talk about is the Healthy Environment for All Act. But before I do that, I just wanted to talk briefly about the Environmental Justice Task Force. The Environmental Justice Task Force was also funded in 2019 through our legislation and was responsible for recommending a lot of the strategies for incorporating environmental justice into state agency actions. The task force released its final report in the fall of 2020. And one of the subcommittees of the task force was specifically on mapping. And so here are just a few of the recommendations from the task force. And the other picture is just the cover page of those task force recommendations. The recommendations of the task force that were specific to the environmental health disparities map, I'm just going to talk about this one here on the upper left hand of the screen, which says that agencies should use the overall environmental health disparities rank of 9 and 10 as a starting point to identify overburdened communities, that the map is really a pre-decisional tool. Meaningful community engagement is needed, and then you can add the map layers that exist for additional insight into the communities. And then what happened after the task force was that this Healthy Environment for All Act was passed in 2021, which really just implemented many of the task force recommendations to reduce environmental and health disparities in Washington state. Overall, the HEAL Act is what we call it for short, requires that 7 state agencies participate in it. and other state agencies can opt in. We now have 5 other state agencies that have opted into the requirements of the HEAL Act, and really just focuses on environmental justice and incorporating those into state agency policies. It focuses the expenditures on overburdened communities and vulnerable populations. It creates a platform for communities to advise state government, and all the agencies need to track and measure and report on their environmental justice implementation work. The HEAL Act also outlined specific tasks related to the environmental health disparities map, in that we need to track changes and disparities over time. We need to further develop the map by engaging with communities, researchers, and the Environmental Justice Council, which was created with the HEAL Act. We need to perform a comprehensive evaluation every 3 years, and then expand training and just provide support and consultation to state agencies about how they can use the map. The next piece of legislation that passed that references the map is the Climate Commitment Act. And this act establishes a cap and invest system that will steadily reduce carbon emissions and air pollution while investing in green infrastructure, multimodal transportation, and environmental justice. And yes, as I mentioned, it will use the environmental health disparities map as one of the data sources to select overburdened communities. There's also the Evergreen Communities Act, which is an urban forestry law that requires our Department of Natural Resources to identify priority regions for urban forestry programs, and mentions the environmental health disparities map specifically in the law as a resource for identifying those populations. And then I just wanted to highlight some of the uses that our Department of Commerce has been using the map for. They have several climate-related programs, clean buildings, community solar, electrical grid modernization, and electric vehicle charging that have really used the map to prioritize communities, prioritize grant applications, and confirm eligibility for receiving those resources. And then lastly, I just wanted to share where we are. So we just released at the end of July our 2.0 version of the map, which updated the data for many of the indicators, and then we updated the methodology used for 2 specific of the 19 measures. And our next steps with the map, we're going to continue working on the tasks that were outlined in the HEAL Act. One of those is updating and maintaining the map. And so we're already starting to plan for the 3.0 version. Don't really have a timeline for that yet, but we're starting to think about measures that we will be adding to that version. And it's really important for us to do meaningful community engagement, including tribal engagement, and we're required to consult with the Environmental Justice Council as we move forward. We have formed a technical work group that includes academic partners and other state agencies, front and centered, and other partners from EPA, EJ Screen, and CalEnviroScreen. And the goal of that work group is really to work through some of the technical aspects of the AHD map. We're actively working on a few new indicators that we hope to include in the next version related to asthma, pesticide exposure, and wildfire smoke exposure. And that is all I have for slides, and I would welcome any questions. And this is my contact information.
Thank you, Jennifer. Just as a reminder to the audience to use the Q&A box to put in any questions you might have. You can also raise your hand and ask your question out loud if you would prefer that option, but I would have to unmute you, which is why you would have to raise your hand. Let's give folks a couple of minutes to put in their questions in the Q&A box. All right. Looks like we've got a question, Jennifer.
Yeah, questions about whether any county health departments have used the environmental health disparities map. I do know that our largest county health department, Seattle-King County, has used the map. We did get a request from them to create a county version of it, which is challenging for us because we use statewide data, but we did provide them with all of the data, and you can download it all. It's all available. Okay, what software was used to create the map? So it's actually a custom contracted built platform that we used to create the information by location.
And as folks are thinking about some of the questions they want to add, I'm curious, Jennifer, we had Arizona Department of Health present about 2 days ago on their tracking program. And I asked them the same question of what kind of outreach are you folks doing to let your partners know about your portal, and do you have a sense of who's using it outside of the local health departments?
Yeah, that is a really challenging question because we don't really know. We do know that state agencies are using it. We hear about, examples from them. We know that some of the community-based organizations that Front and Centered are definitely using it. Yeah, so those are the places where we know for sure. We have been working closely with some of the educational school districts to create a high school curriculum that uses a lot of our tracking network tools. We worked with them to create like some modules that high school teachers could use. And then we recently hosted a health science contest where they had to use our tools. So we know that high school students are using it. But other than that, we have heard examples of our county health departments, but some of it's just kind of a mystery.
And is there an interest on part of Washington State Department of Health to know who's using the tool and for what reason?
Yeah, I think, part of what we're hoping to do specifically around the EHD map is really do more community engagement. We're hoping to hire a specific staff person that would help us with that, to really engage communities and, help us to make it more user friendly for them, to be able to use it to advocate for themselves. But we haven't done a lot of that work yet. We are, with this recent release of the map, hoping to do some public webinars that we'll find out a little bit more. With the Clean Energy Transformation Act, the main audience for that was the utility companies in Washington, so they are now required to use it. So the indicators that we're looking to add, I think I mentioned a couple of them. One is asthma data. We unfortunately don't have a data source that allows us to geocode the asthma data that we have and make that available at the census tract. So we're planning some modeling work with our University of Washington partners to be able to do that. We also are working on a pesticides exposure indicator. One of the pieces of feedback that we've received is that a lot of the measures are more urban focused. And so that's one of the reasons for the pesticide indicator. And then the last one is wildfire smoke exposure, which also primarily gets to the eastern side of Washington state, has more wildfire smoke issues. Okay, and then around the state policies, has DOH been involved in advocating that the tool be used for development and legislation? No, we can't really advocate because we work at a state agency. So, we've just put it out there. Our partners, Front and Center, I think, did that mostly for us in creating the HEAL Act. So.
Any other questions for Jennifer? And remind me, Jennifer, how long has Washington Department of Health been a tracking grantee?
Yeah, so we were one of the first. So we've had the grant since 2002. I believe I wasn't here at the time, but if we have a few minutes, I could just do a brief demo of it, if that would be of interest.
I think that would be super helpful.
Okay. Hold on a sec. Let me get that up. Okay. See that?
Mm-hmm. Yep.
Okay. So this is our information by location tool. We have 7 different maps. The environmental health disparities map is just one of those. And then when you click on that, it shows the overall ranking for all of those 19 indicators. Let's just zoom in. And then when you click on one of the census tracts, what it does is show you the overall rank and then the rank for the 4 different themes. You can then click into one of the 4 themes and it will show you each of the indicators and what the rank is for that census tract. And so that is really useful. It also pops up this demographic details for that particular census tract. So you can see that. And I mentioned all of the underlying data are there. And if you click on that little chart icon, you go to our, this is our data portal, and it will automatically pop up that particular indicator. And then you just hit submit and it will show you all of the data for that particular census tract. You can export all of that data here with this export button. And then one of the really interesting features is our map features. I mentioned the tribal land boundary layer, but other partners are using it for different reasons. Our ATSDR site assessment program is really interested in using the map. So we've added a couple different layers for them. They're interested in childcare centers and how close they are to different hazards and what the ranks are. So we've added that. There's farm worker housing, prisons, and these are all our hazardous waste sites and Superfund sites. When you click on that, it just adds those to the map. So you can click those on and off. That is pretty cool. We have a locate address. You can put either a zip code address or the census tract identifier if you know that there, and it will take you to that place. This little tab gives you overall information about the tool, and then links to our technical report that we have, which is a 94-page report that outlines our overall methodology, talks about the individual indicators, so that is there, along with a couple other resources, the Environmental Justice Task Force report and recommendations. This was our report for the first version that we released, which is still there. And yeah, so that is sort of just a high-level overview. But each time you click on these indicators, the map then refreshes to show the data for that particular indicator. Yeah, that's kind of just a quick overview.
Great, thank you so much, Jennifer. If there are no other questions, we can go ahead and wrap up the webinar. I just want to thank Jennifer for taking the time for the wonderful presentation. I want to thank all the attendees for participating and asking great questions. And with that, just want to remind folks that our last webinar in the webinar series is set to take place tomorrow, and I'm going to drop the registration link here in the chat. And also don't forget to take the survey that's going to pop up as soon as you exit out of this webinar. With that, thank you so much and hope to see you tomorrow. Thanks, Jennifer.
Bye.